of pneumonia. What are the features of pneumonia? Okay, the features of pneumonia is, so is there infection? You know,
Fever.
we are talking about bacterial growth, virus
Fever,
growth, fever.
cough,
So whenever we have infection, yes, very good. Fever,
Fever.
cough,
ma'am, fever, cough,
rigor,
yellow sputum,
yes. Yellow
Shortness
sputum
of
is
breath.
not an, you cannot say yellow sputum, okay. Sputum.
and fine
Sputum,
Shortness
and
of
coarse
breath.
crackle,
मैडम
rigor,
Shortness
चेस्ट
of
पेन
breath.
होगी, शॉर्टनेस ऑफ ब्रेथ होगा,
yes,
restlessness,
shortness
agitations,
of breath,
confusion,
wheezing,
crackles,
ma'am,
crackles
fine
when
or
there is
coarse
Increase the
movement,
crackle,
yeah,
fatigues.
crackles, yes,
Increase the
crackles,
fatigue.
dyspnea,
dyspnea, yes.
dyspnea,
Okay, do not say yellow sputum, just say productive cough. Okay, a better word to say is
and yellow
productive
sputum,
cough. Lung consolidation, so there's sputum all over lung, so lung become consolidated.
ma'am, fine and coarse crackles,
Crackles, yes. Okay, now I want to explain you one thing. So just imagine this is my alveoli, this is my alveolar duct, this is my alveolar duct, and alveolar duct terminate into alveoli. Alveolar duct is terminated into alveoli, and this is my capillary, which is all around this alveoli. Okay, there are, I'm just making it over here. So what is happening? So okay, does anyone know about hemoglobin association dissociation curve? Have anyone heard of this? Yes or no? Does anyone know? Just say no. If you know, then say yes. Farhad? Farhad,
Yes, ma'am.
do you know what
Yeah, I can hear.
hemoglobin association dissociation curve?
Oh, ma'am, I don't know.
Okay, don't
If
know.
I knew it,
So
ma'am, I would
let
have
me
answered.
explain you. Okay. I thought that you were lost and found. That's why we're bringing you back. Okay. So what happened? Okay. Listen, your blood comprised of hemoglobin? Yes or no?
Yes, ma'am.
And in your alveoli, you have oxygen? Yes or no?
Yes, ma'am.
So when we are talking about at lungs level, we are saying that we want our oxygen to associate with our hemoglobin. This is called hemoglobin association. And at a cellular level, okay, if I say this is my tissue, a cell, and this is my blood vessel, and here, and over here, I have my hemoglobin, okay. Hemoglobin is associated with oxygen molecules. Now I want my tissue to get oxygen. So I want my hemoglobin to dissociate with oxygen. So over here, I want my hemoglobin to associate it with oxygen. Over here, I want my hemoglobin to dissociate with oxygen. So this is known as hemoglobin association dissociation curve, and it depends upon so many things. It depends upon so many things: temperature, your pH, your oxygen level, or so many things. Okay, but so this is something on hemoglobin association dissociation curve. Now, what's the importance of this thing? Okay. Now, when a patient is having pneumonia, in pneumonia, the alveoli will get filled with fluid. Transudate, exudate will fill up in your airway. Yes or no?
Yes, ma'am.
Yes or no? So
Yes, ma'am.
now it will thicken this area between your blood and your capillary, your blood and alveoli. So now it becomes very difficult for your oxygen to get involved with hemoglobin. So there will be decrease in a perfusion. Yes or no?
Yes,
Your
ma'am.
oxygen will not be able to get perfused with the hemoglobin
Association.
or into the blood, because there is there will be difficulty in hemoglobin association, okay, because there is an fluid in your alveolar cavity. This is called decrease in the perfusion. This is called decrease in the perfusion, and you will also have difficulty in the ventilation. You will not able to. What is ventilation? Is ventilation simply means bringing air into the lungs or removing air out of your lungs. It is called ventilation. Okay. So there will be a problem in ventilation also, because there is so much of productive cough. Your airway lines are so filled with thick sputum, mucus. So there is difficulty in ventilation. So there is a decrease in your ventilation and your perfusion. Perfusion is denoted by Q. So there is a decrease in the ventilation perfusion ratio. Your body will not get good amount of oxygen. Understood this thing? Now understood one thing.
Yes, ma'am.
In your heart, there is an aorta. Okay. In your heart, there is an aorta, and aorta is lined with chemoreceptors. Aorta is lined with chemoreceptor. I have told you earlier. So when there will be
Yes, ma'am.
decrease in the VQ, when the blood will reach to your heart, into your left atrium, then your left ventricle, okay, left ventricle, then aorta. So in aorta, there is a chemoreceptor which will assess the quality of oxygen in the blood. And now they will consider that this blood is basically having network problem. Can anyone say? Can
Yes,
you hear
ma'am.
me,
Your
Shashikala?
voice breaking.
Achha, okay, my voice is breaking.
Your video also stucking, ma'am.
Is this clear now?
Yes, ma'am.
Now can you all hear me and see
Yes,
me?
yes, ma'am.
Yes, ma'am.
Yes.
Yes, ma'am.
So where was the last I was? So what was the last topic you heard from your end? Let me see. I was saying that there is a
Yes,
decrease in the
yes.
VQ, ventilation perfusion, and when the blood will receive back to your when the blood will receive back to your heart, what will happen there? The blood will have less oxygen. So the
Less oxygen.
chemoreceptor will get triggered and they will increase your heart rate. Because we want more oxygen. So we will pump more blood. So there is heart rate and there is increase in your respiratory rate as well as your heart rate. So these are the also two signs. So whenever your patient is having any kind of respiratory problem, that's why
Heart
your
rate will
heart
be-
rate goes up.
Yes.
Okay. So there's increase in the heart rate, there's increase in the respiratory rate, they decrease in the ventilation perfusion ratio, there is productive cough, there's fever, there is shortness of breath, there is dyspnea, and there is lung consolidation. And understand one thing, there is something called tactile vomitus. Does anyone know what is tactile vomitus? Okay, now understand one thing. Okay. Just put your ear on your table and scratch. Put your ear on the table and scratch. Everyone just do this thing. The sound and just scratches like this in the air.
Yes.
Yes, ma'am.
So in which way will you hear the sound more?
More scratches sound will be there, ma'am.
When you are putting your
Like-
ear on the table
Yes, ma'am.
and you're scratching, so you will hear more sound because air travel faster in a solid media. This is what we know. Okay.
Okay. Okay.
So now there's something called tactile vomitus, which when we keep our hand like this in your back of a patient, if I don't have something to say, so just imagine. Can you see this thing? So when I'm keeping a hand on the back of the chest, and I'm asking patient to repeat this 99, 99, 99. So 99 will produce an sound, a vibration, which will follow all your lungs. So as in pneumonia, there is consolidation. So the vibration will increase in a lung of a pneumonia patient. So they is called increase in a tactile formitus. Understood? So there will be
Yes.
increase in a
Yes, ma'am.
tactile formitus because there is consolidation in your lungs and sound travel faster in a solid medium. That's why you will hear a high tactile formitus. Understood what is tactile formitus?
Yes, ma'am.
Yes.
Okay.
Yes.
Okay. And you can call it a bronchophony also. Understood? Okay. Can we just straightforward move to the complication? So the complication is your parapneumonia influenza. Parapneumonia effusion. You will go home and you will study about this topic. Okay, what is effusion? Effusion. Okay. Second thing is the emphysema. Emphysema means this is okay. Just emphysema means this is my lungs. Okay, and this is my cavity. And when there is a pus,
Pus in the pleural cavity.
very good. Pus in the pleural cavity is called emphysema. Emphysema. Very good. Pus in the pleural cavity is called emphysema. Okay. Then you can also have lung abscesses. Abscesses mean फोड़ा. तो गर्मियों में ना इतने फोड़े होते थे ना बचपन में. Do you remember anyone who understands Hindi? So whenever we were kids and it's a very hot, humid time and we're just playing, every time we are just playing here and there, barefoot. We're not caring about anything. Okay, so at that time we get big abscesses all over our body. Nowadays we're not having, you're just having some pimple or something like this. And this was very, very painful. I remember when I was kid, I used to go to my just maternal nanny side and I used to just play every time. So I used to have it. Okay. Next is ARDS, acute respiratory distress syndrome, that we're going to study about tomorrow. Okay. Next, now let's learn about management of pneumonia. So it is infection. So every infection is treated with your antibiotic. Okay. So the first problem infection, the bacterial growth. So you're going to halt the bacterial growth by giving antibiotic. And second is your oxygen, because they decrease in the ventilation perfusion. So you're going to give patient oxygen. Third is your ventilator. Okay. And spirometry you're going to do, postural drainage you're going to do, and your chest physiotherapy you're going to give. You can give bronchodilator depending upon the case to case. Understood? Antibiotic is given
Yes, ma'am.
every time because it
Yes.
is caused due to infection. Understood?
Yes,
Pneumonia,
yes.
Yes, ma'am.
cause of pneumonia, exactly what happens in pneumonia. Okay. Then you can do what are diagnostic? Chest X-ray, right chest X-ray, sputum culture,
CBC, ABGs.
CBC, very good. ABGs you're going to do CBC, sputum culture, blood culture, okay, chest X-ray, bronchoscopy. Okay. Next, learn about sputum culture. How to take sputum culture? Morning fresh sputum culture is taken.
Early in the morning,
30
ma'am.
ml of sputum culture is taken in a sterile bottle. LPN can take, UAP can take sputum. Understood?
Yes.
Yes, ma'am.
Rinse
So,
the mouth, then.
sorry.
Oh, first eliminating
First
the
day, first
patient,
yes.
rinse the mouth, then stimulate the cough and give the sputum.
Rinse your mouth with normal water on
Yes.
line. Do not take antibiotic.
Break.
Before
Yes.
taking antibiotic,
Before.
you need to give
Yes.
sputum.
Yeah. Yes.
Yes.
Before taking antibiotic, you're going to give sputum. Okay. Understood till now?
Yes,
Yes,
ma'am.
ma'am.
Yes.
Okay. Good. This was all about your pneumonia. Okay. Next, I want to talk about